Who is really running Medicare? To answer that, we need to delve into the history of this crucial program. The story begins in the mid-20th century with President Lyndon Johnson signing Medicare into law on July 30th, 1965. The primary aim was straightforward: to ensure that Americans aged 65 and older had reliable access to health care. It was a pivotal moment in American social policy, marking the birth of a purely federal program solely committed to the health of the nation's older population. For over 30 years, Medicare remained in the hands of the government, serving as a safety net for those who had crossed the threshold into their golden years. But as we approach the close of the 20th century, we begin to see the first signs of change. Fast forward to 1997, and we begin to see a significant shift in the Medicare landscape. 1997 marks the introduction of Medicare Advantage plans, signaling a move towards privatization. This shift was monumental, as Medicare, originally a purely federal program, began to change significantly. Medicare Advantage plans, operated by private insurers but funded by government payments, represented this change. Over the years, these plans have not only grown in popularity but also in complexity, giving rise to a whole new landscape of healthcare for older adults. As we stand in 2024, more than half of all Medicare enrollees are signed up for Medicare Advantage plans. These plans often shine as attractive alternatives to traditional Medicare, offering additional benefits such as dental coverage, vision care, and even gym memberships. Yet, while these perks may seem appealing on the surface, they cast a shadow over significant concerns. However, beneath the attractive additional benefits of these plans, there are significant concerns. Today, Medicare stands at a crossroads, heavily influenced by private health insurance companies. These companies administer Medicare Advantage plans, covering a substantial portion of Medicare beneficiaries. This model, often referred to as coordinated care, brings with it a host of issues. It restricts available healthcare providers by imposing narrow networks and requires prior authorizations for many services, potentially delaying or even denying necessary care. The introduction of private insurers has injected a profit motive into a program originally designed as a safety net for older adults. This shift to privatization raises concerns, as insurance companies and their agents often benefit financially from enrolling individuals into Medicare Advantage plans. This profit-driven approach has sparked a debate about the true beneficiaries of these plans. Are they genuinely serving the best interests of their members, or are they simply a tool to maximize profit for private insurers? This raises questions about whether these plans genuinely serve the best interests of their members. The Centers for Medicare and Medicaid Services is responsible for overseeing all aspects of Medicare. But is it up to the task? This is a question that resonates loudly in today's healthcare discussions. You see, managing and regulating the private plans under Medicare Advantage isn't a walk in the park. The rapid growth and influence of private insurance in Medicare have posed significant challenges. Critics argue that the regulatory prowess of CMS is being outstripped, leaving room for potential exploitation. This concern has sparked a call among experts and policymakers for increased transparency and stricter regulations. They advocate for a system where Medicare Advantage plans prioritize patient care over profits. It's a call to put people before dollars to ensure that this safety net for older adults serves its purpose effectively. So who really runs Medicare? It's a complex question with no easy answers, but it's clear that the balance of power has shifted significantly over the years.